number of people, so we get into that today. We have two guests in the studio. Rhoda Wajiro Kibunja is a patient, and she joins us this morning. Good morning, Rhoda.
Good morning.
Karibu sana.
Thank you.
Thank you for joining us in this conversation today. Dr. Noshad Karim is a fibroids treatment expert at the Aga Khan University Hospital and is also here with us this morning. Good morning, Dr.
Good morning, and thank you for having me.
Thank you for coming, both of you. Also, let's settle things a little bit. First of all, we start this off, usually welcome our guests to the studio with a proverb. Rhoda is smiling, so she knows what we're talking about. We go around the African continent every week. We come back from a particular country. Dennis comes back with their proverbs. We'd love to get your interpretation.
Yes, just came back. We from Liberia, the oldest republic in the continent, formed in 1847. By returnees, released slaves from the United States of America, so African Americans coming back and form the republic. But another first from this country is that it is the first country in the continent to elect a female president. So Ellen Sirleaf Johnson then becomes the first female president elected by the people in the continent. They are rich in timber, they are rich in diamond, they have rubber, and they have gold. So talk about pushing the economy forward. But let's go to the proverb. When the fowl is being slaughtered, let the turkey not laugh, because after the fowl, it will be its turn. Ladies, go first. How would you interpret it?
I think I would, let me keep it simple. I think it's do not laugh at your neighbor's misfortune, because you could be next. Yeah, that's how I would interpret that proverb.
Doctor, how would you interpret it?
I would interpret it in a similar way, that don't laugh at others when they stumble or fall. You can take a fall anytime as well.
Yeah, you need to see if they slip because there was a banana peel. Remove the banana peel because you might be the next. Asante sana for the interpretation.
Thank you. So at some point or another, everybody, at some point, most people would have heard about fibroids. I've heard about them. A larger number of people from that number would have experienced them. But sometimes we don't really know what they are. So we'll start with you, Dr. What are fibroids?
So fibroids are benign growths that occur in the uterus. So they're made of the uterine muscle. So they're benign, so they're not cancerous. And more than 50% of women at some point in their life, or more than 50% of women experience fibroids, or suffer from fibroids. So yeah, that's what they are.
Okay. And what causes them?
So the exact cause is not known, but genetics play a role. And then also their growth is driven by the hormones that the normal cyclical hormones that women experience. So the exact cause is not known of what causes them, but we know what drives their growth, and genetic factors play a role.
Yeah. So, Rhoda, us of this gender,
we the people.
We the people. You know, we hear about fibroids, and we most of the time don't really understand how deep it goes. At times you are with your significant other, you hear about it, but to understand what exactly women go through is in one way or the other far removed because we're not dealing with it. What's your story?
So my story with fibroids is it's a long one, because I first got, I think, diagnosed with it in 2018, and it only got diagnosed out of an emergency, meaning all my visits to the doctor, we kept missing that one issue. That I could be suffering from fibroids, and what I was, the symptoms the symptoms I was displaying before the diagnosis was made is that I used to have very heavy menses. There was also a lot of pressure on my bladder. which obviously, when there's pressure, it means you're making frequent visits to the toilet. The other thing is you also have this bulge on your lower abdomen, and you're not quite sure whether it's just that you have gained a little weight or it's because of, you're not sure what the cause is. And then it also then means that for some, they have difficulty when it comes to also being intimate with their partner. So once the diagnosis was made for me, and that's, like I said, it came out of an emergency because I woke up one morning and I was bleeding, and I could not identify the problem. And at this point now, I quickly called my mother, who was having had, as Dr. Noshad said, it's sometimes genetic. Mm-hmm. So she had gone through the experience. So actually her first suggestion to me was to have me diagnosed whether I have fibroids. Mm-hmm. And sure enough, that was the problem. And because it was an emergency, I was going from diagnosis right into surgery to deal with the fibroids. Now, at the time, in 2018, I had to undergo a keyhole surgery because I was reluctant to do major surgery. I have 2 children, and my last child I gave birth through CS. I had a previous surgery, so I had 2 incisions that were made at the same place they were going to do the incision to remove the fibroids. And to me, that was frightening. So I opted for keyhole. It was not very thorough because 6 months after the keyhole surgery, I found myself with a fibroid that might have been overlooked. So I was back into surgery again. And what we don't get warned is that most women don't get warned that the fact that there's a chance of relapse. I mean, you end up having the same fibroids growing all over again, even after you have had them removed. And I found myself again diagnosed in 2025 with more fibroids. But because I did not want to go through surgery again and all that pain, the recovery and all that, still with the same symptoms, heavy bleeding and all that, I was compelled to search for other alternatives, and that's how I actually ran into Dr. Noshad through my own research. Yeah.
Thanks, Rhoda. And we'll come back to how the presence of such a condition affects the normal way of life, or just being human and other activities therein. But Daktari, you mentioned that around 50% of women are bound to experience the fibroid condition. I don't know whether it qualifies to be a disease or... So if that is known, are we able to trace back and say this could be the causative agents? This is what leads to, besides the genetic factor. I'm asking this because there are many theories out here, and it helps to demystify. I've heard stories that use of contraceptives, perhaps from an early age or whatever age for women, could lead to, don't know how true that is. Another thing has been that to deal with fibroids, just give birth and they'll be done away with. But do we have other agents or factors we can attribute to the cause of fibroids? And is giving birth a solution to that?
It's an interesting question.
Right.
So fibroids are driven by or their growth is driven by the hormones that are produced by the ovary and that sort of are present in every woman. So in a way, yes, when you get pregnant, some of those hormones that cause the cyclical changes are suppressed during pregnancy, and that can cause the fibroids to shrink. So in a way, that's true.
Okay.
But that doesn't mean that you
Keep giving birth.
Keep giving birth.
Okay.
Yeah.
Right?
Yeah.
Uh-huh.
Yeah. So that's the
Okay. Is there a correlation between the use of contraceptives and development of fibroids?
Again, I don't think there's any solid research that has proven that. So it would be hard to pin it only on that, because it's a number of factors that act together to cause fibroids.
So what has the research shown towards the management of fibroids? What has it shown that you can actually say, like Rhoda's given a very valid point here. From where she is, she's not interested in going through and having a surgery again that's going to be invasive and that's going to have a long healing process and time and all of that. Because, from what we hear and understand, your removal of fibroids, you're not moving for the next 2 months, and then you heal and all of this. So what has the research shown for how this can be managed or shrink them, or?
So traditionally, broadly speaking, there are 4 treatment options for fibroids. So for those who are near menopause and the periods are already becoming further and further apart, they're starting to experience the hot flushes, and for those women who have fibroids, and if they're symptomatic, we can say, hold on. When you reach menopause, your hormones will go away and the fibroids will shrink. Then surgery is another option. And again, we have 2 types of surgery. We have the surgery where you remove the uterus together with the fibroids, and we have the surgery where we remove the fibroids but leave the uterus in. Then we also have medical therapy, but medical therapy is mainly based at controlling the symptoms, not the fibroids. So, for example, there's medication that reduces the intensity of the bleeding, but it's not really treating the solution. It's not really treating the problem, sorry. And then the 4th option is minimally invasive treatment, and that's procedures like uterine fibroid embolization, which is what I do. And that involves going through a small blood vessel in the wrist, down to the uterus, down to the blood vessels, supplying the uterus and the fibroids, and putting particles to block the blood supply to the fibroids and killing them.
Is that the pinhole procedure, or is that different?
No, that's different.
That's different.
Yeah.
Okay. Well, Rhoda, the discovery that there's this condition that is something growing, and it's beginning to interfere with the normal cycle, the heavy bleeding. I can only imagine that if it is work or just normal movement and other things interfered with your schedule of activities, among other things. You're a parent, so there could be presence of a spouse, so intimacy could be affected. But largely, how was it trying to come to terms that I have this condition and these are the interferences that it is running in my life?
Okay. Like I said, the first diagnosis, the condition or the diagnosis sprung up on me. But before the diagnosis, yes, it's true. It interfered a lot with my day-to-day life. Like I would not, like on those days, especially the beginning of your menses, I'd stay away from work. I was also in school at the time. I'd stay away from school. Simply because you don't want to embarrass yourself, because there's absolutely nothing. I came to the conclusion there was nothing I could do to avoid embarrassing myself. In fact, there are instances when you think you're fine. You could even be traveling for long distances, and then what I was told is that sometimes when you're having very huge fibroids, it's like the brain is registering you're pregnant. So it has this supply of blood to that area, such that you could be fine 1 minute, you're traveling long distance, and then the minute you get up, you cannot stop the flow. And those were the days now I would choose then to avoid the embarrassment. I just stay put in the house. until I manage that situation, and then when I can see it has reduced, I come out and enjoy my presence amongst everybody else. Yeah. So those, to me, that was the main factor, because so that means, and then sometimes it will also be prolonged, meaning when most people have their menses for 3 to 5 days. Mine would run on for almost even 2 weeks, 3 weeks, which also meant that I became anemic. You become anemic, and you have to now factor supplementing your deficiency with either food or supplements. So there were those issues that really bothered me, and but at the same time, as you're having to deal with that, you now have to also factor in that you either continue with that circumstance, or the other alternative is surgery. Yeah.
Rhoda, I mean, just as you talk about it, there is the aspect where you're dealing not only with the situation in terms of, you are unwell, there is your social life is affected. There is your family at that point as well, and one would hope that they would come through and hold your hand. But then again, it is also not guaranteed that when it happens, they would be there. So how does this affect your mental space, if it did? And how then was the support from family, friends, help you deal with the problem? And when they were not there, how was it?
Okay, I think yes, a good chunk of my situation was dealt with by family and friends. When I'm home, they understand. I think at the time when I was first diagnosed, I had very small children, and at one point they thought, when one of those days when I had an accident, when they were pretty young, they thought we're losing our mother, that kind of situation. But at least you have the support of friends and family to just step in and just kind of handle the situation and just try and minimize the urgency of what you're going through. Other than that, there was also the I always say I especially with my second diagnosis, I was very fearful. Fearful of, and there was a lot of anxiety about, because then the only alternative that was being posed to me now was the hysterectomy. That is the removal of the fibroids and the uterus, and that caused a lot of anxiety for me. And I would say I was very anxious, and obviously there's a level of sadness, because you're thinking, I think at that time I was like, I'm not young anymore. If I go in for surgery, you're wondering, will I come out? And obviously I'm not coming back out intact. There's a part of you that's being taken that is meant to be part of your it's meant to be part of me. So it was, I must say, it was depressing having to deal with the thought of going through surgery, and more precisely a hysterectomy.
Okay, let's take a break and we'll come back and then continue with this, obviously, and then hear from you, Dr. because the surgery is what is given us the option for a majority of women who have fibroids. It's the option. So it's either have the surgery or continue to live in this harrowing situation that Rhoda talks about. So let's come back and see if it still is the thing that we're saying. If you have fibroids, and not the little ones, the ones that are obviously, changing your life, then is surgery the answer? We'll be back. We're talking about fibroids on Healthy Friday this morning. Rhoda's here. She's telling us about her experience. Dr. Nishad also here, telling us, okay, well, this is what we're going to look at the solutions. We'll also take in some of your comments and questions as we get them this morning. It's 9:31. Continues after this.
This is the Situation Room, the only way to start your day. The world's greatest football tournament is here.
Vamos, the greatest show on turf of the biggest ever seen on planet Earth.
And wherever the game takes you, KTN, Radio Maisha and Berur FM have you covered. Missed the match? Catch every goal, every moment, and every talking point on KTN.
We are going to focus on two groups.
Which two teams will prevail to the next round?
The midfield that Mbappe is actually carrying to this particular World Cup is out of this world.
For every match, every attack, every save and every goal, tune in to Radio Maisha and Berur FM for live commentary that puts you right inside the stadium. Watch the highlights, hear the passion.
France itakuwa final na itachukua kikombe. World Cup mpango mzima this time round tunaichukua Afrika.
KTN
World Cup 26.
Africa!
Leave the World Cup.
Josephine Nyamu, the principal, Lukenya Girls High School.
Without knowing how to manage your money, to invest your money, how are you going to maintain your stability, your financial stability?
Business and physics, it is really helpful because this involves writing short notes of a topic without referring first.
This is the Situation Room, the only way to start your day.
Fibroids can come back. If they're removed, new ones can grow. So that is there. But in terms of treatment, so traditionally surgery is what has been offered to women, but we do have minimally invasive techniques, so women don't have to undergo big cuts, big wounds, and a prolonged downtime of 2 months or more. So one of the minimally invasive techniques that has been around for quite some time, from 1995 actually, is uterine fibroid embolization, and with that the recovery period is significantly shorter, and it is shown to be as effective as surgery in treating fibroids, especially if they are symptomatic for heavy bleeding.
So what is that, embolization?
So embolization is basically we use the blood vessels like a road network. So we go in through the left wrist artery. So very tiny cut in the left wrist artery. Then we go in with a small tube all the way down to the pelvis, down to the uterus, to the blood.
The wrist in your arm. Not that there's another wrist, but okay.
Yes.
This one. Okay.
Yes. Yeah.
Okay.
Yeah. So we use your blood vessels like a road network. So we go in from the wrist, go all the way down to the pelvis, to the arteries supplying the uterus and the fibroids.
Okay.
And we put in particles that block the blood supply to the fibroids. And this kills the fibroids and they shrink, and the body absorbs them naturally. So no big cuts, no prolonged hospital stay. We do the procedure, you're home the next day, and you're fully recovered within 2 weeks.
Okay. Sounds like it will cost a pretty penny.
Not really. We have a package for it at Aga Khan, and it's around 470,000 shillings, which includes everything, including the one-night stay, the medication, the procedure, everything.
Interesting.
Well, and just to ride on that cost factor, I think one of the most prohibiting element why people do not seek treatment is the affordability aspect of it. And there are also other, I wouldn't say cheaper, but easily accessible ways of, screening to identify the growth, the rapid growth, because sometimes, we have also to demystify, and that's why it's good to have you in our presence today. Sometimes we attribute every painful cramping to fibroids. Is that the case? And does that mean anybody who is having very extremely painful cramping needs to go for screening?
So not every case of painful cramping would be fibroids. So there are many different causes. So always as part of the workup for patients, it would be important to first, if you're experiencing any symptoms that you think may be related to fibroids, the first thing would be to get a consultation with your nearest health facility. And then the second thing would be to get an ultrasound at the very least, because fibroids are easily identifiable on ultrasound. And then if you do have fibroids and they are symptomatic, then the more defined pathways of treatment then sort of get followed.
All right. And what would be these symptoms that one would see or feel that would warrant them, in your opinion, to seek now like an ultrasound or at a medical attention? What would be the symptoms that are different from normal cycle and that would be indicative of here? There could be signs of a false pregnancy, maybe they are over too grown.
So the commonest symptom that fibroids present with is heavy menstrual bleeding. And that's our number one sort of presenting complaint for all the patients that we see, heavy bleeding. Second sort of complaint would be related to the size, so bulk, symptoms related to the bulk. So if you have fibroids pressing on the bladder, then patients will present with symptoms related to waking up at night all the time to pee or feeling like the bladder is not emptying completely. Then you can have fibroids also pressing on your rectum, which means that patients will be presenting with bloating, constipation. And then generally as the fibroids grow bigger, we've had a few patients who have presented with just a bulky belly, and this is despite going to the gym. And they say that it's their tummy is not disappearing, and then when they go for a scan, they actually discover it's fibroids. So those would be the second presentation.
Rhoda, you see, let's say your patient is 001, right? So we find ourselves, as we talk about it, is that you had the conversation with mom because you had lived with that, right? And here you find yourself as well then in the same boots, going through the same process. And it's not easy because even at that point when mom is thinking about it, is the tough time that I had is what my daughter is going through. That would then inform us starting to have these conversations perhaps early with our children, us having these conversations openly, so even with other women, for us to even push the conversations better, because as we talk about the cost factor, we only have results in numbers. So are we seeing these conversations now in spaces where you're in, having these conversations with the young girls to know exactly if you see this symptom, perhaps it's important to go to hospital early so that by the time Daktari is getting in, we're not getting in at the tail end when you're struggling to go to the gym, yet this is something that would have been handled way, way earlier when they were still small.
I think that conversation now is making its way in every space. And in fact, sometimes I say had that conversation started earlier, because I found out about UFE, I think mainly when there was this campaign, especially with Lupita going public with her struggle with Lupita Nyong'o, that is when she was, when she came out public with her struggle with fibroids. That was towards, I think, 2024, 2025. And hadn't that conversation been there, I would not have also gone onto the internet and found solutions as to how women were dealing with it, especially overseas, because that's where I first heard of UFE. As Dr. Noshad said, it's been there. Even in Kenya, I think it's been there longer than. I think he once mentioned it's been there since 2009. Yeah. And had I known about it, I think that would have been my first option before I went for surgery. Yeah. So yes, and knowing that it's also children or girls are genetically predisposed to having fibroids if the generations before them had them, then it also makes sense that mothers should also begin having these conversations, so that you're more or less monitoring and seeing how best to deal with the situation. I do recall when I first got I got the second surgery to get rid of the fibroid. We used what we call a hormonal IUD to kind of temper the fibroids from growing again. But that was just temporary, because the hormonal IUD that I got, I think, only lasts for about 5 years. So I think once it expired, the fibroids took full reign of the uterus again and started growing. And to me, I think they became even more aggressive. Yeah. So, the conversations need to be had.
For sure.
Yeah.
Well, and Dr. now, this is a reproductive organ we're talking about. So when there is in the interference of the natural behavior or conduct of the organ, then would mean some of the natural functions like conception may not happen as expected. How does you say UF? What do you call it? UFE affect, if at all, the fertility of the individual?
So, what the most recent data is showing is that fertility outcomes in patients who undergo UFE are equal to patients who undergo surgery. So there's no difference in your fertility outcome if you have surgery or if you have UFE as a treatment for your fibroids. Now, traditionally, the old thinking has been that it can have an impact on your fertility. But like I said, the newer data is showing that there is the outcomes are similar. Yeah.
But, Doc, as you talk about reproduction as well, when you have fibroids, you're told to have a baby, itaisha over time, But does it affect one from conceiving?
Yes, so fibroids can impair fertility. So it's important to understand that as a baseline, if you take a normal woman without fibroids and you take a woman with fibroids, their fertilities are already different, because fibroids can affect the implantation of the embryo. They can, if they are located where the fallopian tubes open, where the egg comes from, and if they are located there, they can actually prevent the egg from getting into the uterus. So already as a baseline, your fertility is impacted if you have fibroids. So that's important.
So therefore, there's talk that if you're struggling with fibroids, you need to get pregnant, then is misinformation out here, and perhaps it's something that needs to be debunked for people to know, perhaps when you're dealing with it, the best thing to do, or the only thing to do rather, is to go get diagnosed, get treated, for you to even have that chance of having a child.
Yeah.
And now with the conception, the beginning of life is also, is very important. So if a conception happens in a uterus that has fibroid, is there any known effect to the embryo, to the unborn, to the newly to be born, to the child, and the development of the fetus and all that?
Yes. So number one, if for example, if there are multiple fibroids, and say some of the fibroids are under the lining of the uterus, and if the placenta happens to implant onto that site, then it will have an effect, because the placenta needs blood to grow, or to supply to the baby to grow. Similarly, when you have fibroids, your uterus doesn't have that capacity to keep growing and expanding to accommodate the growing fetus. So rates of premature labor are higher in patients who have fibroids.
Are there known developmental conditions or issues of babies who are born from now the conditions where fibroids have happened? Because, as you say, there is competition between the growth of the baby and the fibroids now in the uterus. How does that happen? I mean, is there any known conditions that could... I'm trying to not sound like a doctor, layman, where a baby can be born with some conditions because they grew up in an environment that was not purely healthy, in a manner of speaking.
Yeah, so the commonest thing is preterm labor or premature labor. So that means the baby is not able to develop fully or complete the 9 months. And being born early has several complications that can occur with it, be it depending on how early the birth is. So it can affect the lungs, it can affect the brain. So there are adverse effects that are associated with premature labor.
So it's interesting. So the advice to have a child or to get pregnant while with fibroids, where it makes sense because then you stop the growth of the fibroid, then could essentially be detrimental to this child as well when the child is essentially conceived.
Yes, especially if there are multiple fibroids that are present when you get pregnant, it can have a...
It can happen. Yeah. Okay, so let's talk a little. We're looking at fertility and all of this. Rhoda, was hysterectomy ever suggested to you as an option?
Yes, it was.
Okay. Yeah. So we've understood that hysterectomy is the total removal of the uterus, and does that, if it's complete, it includes the fallopian tubes and ovaries, right? Yes. All of that is removed. The entire reproductive system essentially is removed. What are the effects? I don't know that there would be effects because you've removed the whole thing. So what doctors would have prescribed this had you already had children? And they say if you've had children, then we can look at the option of removing it. Is it something that is still suggested? Or if you don't have to, don't remove it, kind of thing?
Unfortunately, it is still suggested to women who suffer from fibroids. It's offered as an option. And this is despite the fact that these women are still not yet at the age of menopause, and yet they're being asked to remove their uterus and their ovaries and everything. Yeah.
What are the effects of doing that? Or are there none? Once you're done, you're done?
There are definitely effects. So number one, it's a major surgery. It's not a minor surgery. So there are the complications of surgery itself. And these can range from blood loss, bowel, intestinal injury. So there are those effects. Then the effects if you also remove the ovaries, because the ovaries are what
regulate
your hormones. So you're basically going into menopause once you remove them.
Okay, so it's like forced menopause with a hysterectomy. All right, sorry, just another one here is that Belinda has made a comment here, and she's talked about the fact, so we're talking about numbers here, and it's actually surprising because how much can this uterus take? So she was diagnosed, she had surgery in 2002, and when they did the surgery, they found 48 fibroids.
Yeah, I'm not surprised. We often see very large uteruses with a lot of fibroids.
Really?
Yes.
Okay. Yeah. So with the removal of that, I would imagine that would have been a mighty long surgery to then be able to remove them, and while keeping, the integrity of the uterus and all of that. Yeah. What would be the recovery time for surgery? I mean, Rhoda's here, so she can tell us what she went through in a minute. But from a medical point of view, what would be the recovery time that we are looking at after surgery?
So if it's the traditional surgery of what we call myomectomy, which is removing the fibroids, or hysterectomy, the recovery time for that is anything from 6 weeks and above. So that's quite a lot of downtime.
Yes.
If it is the minimally invasive technique that we offer, then it's maximum 2 weeks downtime.
Okay.
Yeah.
Well, Dr. I'm just wondering. I mean, something one does not want to imagine, but in the event that now a patient comes and it is determined they need to undergo their surgery, they have not maybe conceived before, they're still of a childbearing age, they intend to, but the condition is so severe, you are more than likely suggesting that the removal of the uterus, the whole system. How does one cope? I'm looking at the psychological aspect of it, the psychosocial impact. And once the removal is done, the brain, does the brain register that this function can no longer prevail in this person's life, So how do you find the balance of the physiological aspect is no longer there and the psychological aspect? Maybe Rhoda might be the best person to chime into that.
So for me, I didn't end up getting the hysterectomy.
Right.
But contemplating it psychologically, even before I did it, was something I like I said, caused me a lot of anxiety, caused me a lot of fear. At the same time, you're sad because you're like, okay, do I stay with this condition or go for the option for surgery? For me, personally, I had already made up my mind. I am done having children, so I was not so much worried about the issue of fertility. But still, even when you're not thinking of having more children, you're still thinking of this part of you, especially as he put it, the early onset of menopause. So I'm still thinking of this part of me that God said I should have, but now I need to remove because I'm having all these other problems assigned to just carrying a uterus. So you get conflicted, and there's also a level of annoyance as well, like because you're like, it's hard being a woman.
Gave me this thing and now
the doctor said.
Hey.
You're like, so you have to now, sometimes now, like I said, you just have to take charge and decide, what do you think, other than what you've been told by the doctor, what do you think is the way for you? Because then I took charge of that situation. And like I said, on discovering that UFE was an option, I dropped all other options that had been given to me, and I went towards the UFE option. As he said, it was just a little incision on the wrist. I was home in a day after the procedure, and I've been symptom-free since then.
That's good.
Yeah, the symptoms that I was having.
I mean, it's